Welcome to Global Medical Office Dialogues. The death of George Floyd and others in the United States has sparked an international outcry. Demonstrators around the world have called for renewed dialogue and action to address racism and diversity. Our guest is award-winning diversity strategist, researcher, and author Lenora Billings-Harris, an authority on race and diversity. Lenora was named one of the 100 global thought leaders on diversity and inclusion by the Society of Human Resource Management, and Diversity Women's magazine called her one of the 20 top influential diversity leaders in the United States. She speaks to many of the world's leading companies and organizations about issues of diversity and was a past keynote speaker for our company's Medical Office Live broadcast series, talking to our medical directors and staff about important issues around diversity in medicine. Lenora joins us for this edition of Dialogues to talk about race and unintended bias in healthcare. Lenora, thank you for joining me today in our Dialogue series.
I am thrilled to be here. Thank you so much, Dr. Maddux.
I thought I might start by asking you to just give us a little background on what you see as the distinctions between race and racism.
That's a great place to start because so often people do get this confused. The fact of the matter is that scientifically, there's no such thing as different races. We are far more alike than we are different. Pretty much the only difference is the color of our skin from a scientific perspective. Race is a social construct that came about in the early 1600s in order for white people to create this body of thinking so that they would be more superior. So not just when Africans were enslaved and brought to America, but even before then, in order that people could see slavery as holding people who were less than, they created this construct of race. Racism, however, clearly exists. Racism is about the actions people take based on their beliefs. So the biases, the prejudices, et cetera, that we have in our head, when we take action on them, then that becomes a racist act.
You were a teenager during the civil rights movement, and can you describe a little bit about what today's protests look like to you in the context of the civil rights movement that you saw as a young adult?
When I was 16 or so is when the civil rights movement was already in place, but certainly when the protests started and the riots started, it was a very scary time. And I'm from New Jersey, so I was born in Newark, so I remember that vividly. The major difference, though, between what was happening then in the movement, not just the riots, but in the movement versus today, is that back then it was primarily Black people, African Americans, that were protesting. There were a few white people, but mostly it was African American. Today, it is a rainbow. It is Black and white and old and young. And as you watch some of the videos that are going viral on the internet and on TV, these small children of all colors are asking questions about how they will be treated and how other people should be treated. So it gives me hope this time that there'll be more sustainable change.
Yeah. Let me ask you to complete this sentence. Racism in the world today is?
It is prevalent. And we don't want to think that. We want to think that we're beyond that. But I've been fortunate to do this work of diversity, equity, and inclusion and unconscious bias, et cetera, in over 40 countries at this point. And what I find is that there is at least bias, if not specific racist acts, in every country that I have been to. And the fewer number of people of color, the more prevalent the racism is. And I think part of that is because people are just surrounding themselves with people like themselves, so they see people as different, as threatening.
We did a session at one of our Medical Office Live events that you did a keynote speech around unconscious bias. I'm wondering if you can't give us a little bit of an update on you're thinking about the relationship between unconscious bias and racism.
People are afraid to even talk about bias, let alone racism. And I believe the reason is because they're so afraid they're going to say the wrong thing. That's one reason. And the other is because generally when we think of bias, we think all bias is bad. The fact of the matter is, as human beings, we can't not have bias. Bias helps us get through the day. So all bias isn't bad. I mean, you can tell that I'm wearing a black top as we talk together today. Usually when I'm speaking and presenting, I wear black and then I wear something colorful. That's my bias. I go towards that color because it's easy. So for me, that would be a good bias. However, we tend to think of those biases that label people, and we think that in and of itself is racism. It isn't. Racism is the steps you take based on the biases you might have. So you may think in this case that African Americans are less than for whatever reason, because you've been bombarded by the media, by movies you've seen, etc. But if you're not taking action on it, then you're not a racist. It's a prejudiced thought, but you're not taking action on it. Racism, though, is when you truly believe those thoughts and you take action on them. Now, some of the actions could be unconscious. A lot of them are conscious acts of superiority. And I think the more, though, that we can understand that bias is in our lives, it's certainly in the medical field, the more we can understand that it's there and become aware of it, the more we can disrupt those biased thoughts. Because the good news is our brains are not hardwired to be biased. We can disrupt those neuron connectors so that we can see people in a different light, but it takes action to do that.
What do young people know about race and racism that older people do not? And then the converse, what do older people know about race and racism or think about it that young people don't? I'd be interested in your perspectives on this.
The one area of focus that I'm asked to speak about beyond unconscious bias and racism and that kind of thing, beyond that, the next most popular thing is generational diversity and generational bias. Because in the workplace, now there are 4, sometimes 5 different generations. And what I know to be true is that young people see diversity and see different from older people because they've been more exposed to people who are different. So they see the difference for the most part, but they don't see it as a problem. And so they are more likely to notice when diversity doesn't exist. So we need to hear those voices because they have a different worldview. They can see things that maybe some older people don't see. Conversely, older people can have the wisdom of their years. So older people who have lived through the civil rights era, for example, regardless of whether they're Black or white, they can have something to compare to day 2. So they can see that, yes, we've made some progress around systematic racism, for instance, but there's still a lot of work to be done, where a young person who doesn't have that perspective is wondering, why can't we fix things immediately? And why is it there in the first place? So the two, broadly speaking, the 2 generations, younger people and older people, really need to value that difference. And that's the essence of inclusion and diversity of thought, is to hear it and listen rather than immediately jump to judgment, which is what we tend to do.
Yeah, certainly listening is a key part of it. I'd like to take your comment and think a little more about systematic racism and bring it back into healthcare just a little bit. So I'll start with an observation that I've had for several years on a variety of technical expert panels that I've sat on and at the National Quality Forum, where it's been very clear that our federal government in its Medicare program and some of its Medicaid programs has generally not incorporated into risk adjustment for quality measures the race, geography, or socioeconomic status. And it's always been age and gender and comorbid disease and other things, but never incorporated these elements. And to me, I thought that was a mistake. And I just would be interested, as an example, can you talk a little bit about sort of the healthcare aspect of these sort of systematic, potentially unconscious things that are embedded in our healthcare system?
Absolutely. And as I answer it, of course, you know I'm not a healthcare professional, but I've worked a great deal with various healthcare systems in helping all of the professionals to better understand how biases impact their work. I find it quite astounding that these government agencies are intentionally overlooking the disparity that there is because of systematic racism, because we know that people of color, and particularly African Americans, do not get the same level of health care that others do. And some of that is because of having access to it. But even beyond that, when an African American person comes to a healthcare facility and is talking to the intake person, to the nurse, and to the doctor, they're human beings. And so all of those professionals turn on their biases, not intentionally, I hope, but they do turn on their biases, so that there is clearly research that tells us that there is disparate treatment for diabetes, for heart disease, for almost everything that people may suffer from. And one of the research studies, I believe this one was from University of Michigan, one of the research studies identifies that Black people are assumed to be able to sustain pain better than white people. So they don't believe us when they ask us on a scale of 1 to 10, what's the pain? If we say 9, they're not equating it as what 9 would mean to them. So there's the disparity there. Additionally, if an overweight person of color calls on a doctor or is in the emergency room, what research is also telling us that is that the doctors do not assume that this patient will follow their direction, take the medication, and do the other things in order to take care of themselves, whether, again, if it's a heart attack or diabetes or strokes or any of those kind of things. And so they don't prescribe in the same way that they do to white patients. I'd like to believe that that is very unconscious, because I know how much we're bombarded by inaccurate information about Black people versus white people in healthcare. My work, however, as I've worked with different medical systems, is that it isn't always unintentional.
So let's think about open, honest dialogue for a minute, because I think in the healthcare arena, we need to engage in using tools that we have to have more honest dialogue about this topic. And you have previously talked a little bit about honest dialogue and the use of tact as a technique to try to keep people from being fully defensive when they get into these complicated conversations. Can you describe this a little bit for us?
Thank you for asking, because that's one of the questions I'm being asked frequently. White people are saying to me, and these are my white colleagues as well as clients, et cetera, is I do care about this and I want to know more, but I'm afraid to say anything for fear of saying the wrong thing. Well, the fact of the matter is there is no book that can tell you all the politically correct terms. We're going to make mistakes. I've been doing work in this space for 25 years and I've been in business for 34. And still, even though I live and breathe this, every once in a while I open mouth and insert foot. So my recommendation is, what I invite you to do is to be tactful. You can be tactful and honest at the same time. So you can speak what you're thinking. And when you're talking, especially if you're talking one-on-one, be able to, I encourage you to say to the person you're talking to, I've got a question. You may think it's a dumb one, but I honestly want to know. I really want to know. And then ask the question. Now, don't assume that in this case, every Black person is going to want to answer every question, because some people are just tired, and you need to respect that. On the other hand, there are many of us that say, please ask, because when you don't ask, silence is not acceptable. When you don't ask, you rely on your biases, you rely on your assumptions. So lean into that discomfort, and you're not going to get the same answer from everyone. The question I get asked most often, so I'll share it with you, is, well, nowadays, if I have to use a term, should I say African American or should I say Black? Well, my answer is yes, meaning sometimes Black is more appropriate, sometimes African American is. Black is most appropriate informally. Nobody much is going to be offended. And also, if you're not sure the people you're talking to are all African American, they could be Black from the Caribbean or from Europe. On the other hand, there are some Black folk that don't like being called Black. And here's the reason why. When you read most publications, newspapers and magazines, if they're talking about a Black person, and we know they're speaking ethnically, they don't capitalize the B. Now, they don't capitalize the white either, but there's a choice that you could say American, or you could say Italian American, etc. And so some Black people say, call me African American, because when you write that, you have to capitalize the two A's. So it's a matter of dignity and respect. Again, though, the question is to ask people that you're interacting with. They'll give you their answer. It won't be the absolute answer.
What do you think the state of racism will be like in 50 years from now? What do you think the opportunities are here?
Well, what statistics tell us is that the demographics are changing rapidly. And so well before 50 years from now, the demographics will be such that people that we call minorities, I prefer to call them underrepresented groups in the workplace, they will be the majority. And therein lies the fear, by the way, for many white people, because they're afraid that they're going to lose power. However, 50 years from now, we will look different, and more people will be like young people today, where they will see difference, but they won't see it as a problem. What my hope is that we will have eradicated enough structural racism, those systems that intentionally hold people down. We will have eradicated enough of that we'll be talking about racism from a historic perspective. That's my aspirational hope.
Yes. So individually, organizationally, and certainly as a society, so much of the conversation around racism is inhibited by fear. And I'm just curious on what sort of tools and techniques do you think we can all use and think about to try to reduce the level of fear so we actually get to those honest conversations and dialogue that needs to occur?
Couple of things. One is we fear that which we do not understand. That's just a natural tendency in our limbic system, the nervous system connecting to our brains are trying to just keep us alive. And so if we see a person that we don't understand or who's very different from us, we can automatically be fearful. That's an emotional reaction. So one of the things we need to do is to learn more about people different than us and intentionally surround ourselves with people different than us, because the reason we're fearful is because as human beings, all of us want to belong. It is now being found that that is the most primary need of human beings. It used to be that we thought food and water was the most primary need, but we're now discovering that belonging, connecting is the most primal need that we have. So we tend to belong to groups that are people just like us. The more we can be surrounded by people who are different than us, not just in skin color, but in all other types of ways, the more it broadens our perspective. And most importantly, the more it enables us to have diversity of thought so that we don't rely on those emotional bias thoughts that will pop into our head automatically.
The death of George Floyd and others has sparked responses from all over the world and a very global movement that seems to be occurring right now. Is this surprising to you, the outpouring that's occurred, and just any thoughts or comments as we close this particular dialogue session on just the aspect of this representing all of us as humans and not simply just the U.S. population?
Yes. I was pleasantly surprised to see the protesters and the demonstrations around the world. And I think that's an example, though, of knowing that racism is not just in the United States, that everyone wants to feel equal and to have dignity. I do believe, though, that people are looking for action. So we want to talk about it. We need to have safe places in the workplace where folks can come together, whatever color they are, and ask the questions and hear and really listen. And that needs to happen all over the world. There's also newspaper articles about Black people in Ireland and how much they're protesting. So we need to recognize that the bottom line is that we are all connected. We truly are all connected. And I think that one of the reasons it has happened the way it has happened now is because we were in the midst of a pandemic. So people were watching the news and social media even more than they normally do. So when they saw George Floyd be murdered and watched the entire thing, it is very difficult. It became very difficult for even people who may not want to know these things or see these things. It was very difficult to say, well, it was because he was being a bad person. It was because he was running away, because he was already handcuffed. So you can't turn away from that. And I think more people realized they needed to do something.
Any closing thoughts?
So I like to leave you with a very easy mnemonic that can help you individually as well as an organization. And it's be basic. The first B stands for breathe. Realize you're going to make mistakes. That's how we learn. So just breathe, calm yourself down. The second B stands for be willing to be the other. Surround yourself with people different than you in lots of ways, dinner parties, whatever it is. Be willing to be different. The A stands for ask questions. Listen empathically and ask questions. The S stands for suspend judgment. When you realize you're having that biased thought, just say, thank you very much, move aside. Let me see what the reality is right now in front of me. So suspend judgment. The I is to invite others. Invite others to be in your space. Invite others to be on your teams that are different than you so that you can hear their perspectives. And the C of be basic is the hardest one, which is check your ego at the door. Because as leaders, we have learned how to make decisions fast. We need to slow down, listen, and see if there's another perspective.